This week's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Untoon from Advanced Alternative Medicine Center. We are located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you want to get a hold of me, stopping into the office is always a great opportunity. You get to ask your questions directly without any interruptions. I'll answer your questions and probably do a brief evaluation just out of my own curiosity for understanding what is and is not going on with you. My purpose is to help you solve your health-related issues. If you're still reticent about stopping into the office, if you haven't gotten your COVID-19 vaccine yet, it's okay. You can call me. You can call me at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. I'll be the one answering the phone 90% of the time. Please do not text that phone, as that phone is not equipped to receive texts, but you can email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. Whether you stop in, call me, or email me, it's my pleasure to help you to better understanding what the concerns that you have regarding your health. Today's class is a very, very important class. This class is about a problem that so many people have. They're unaware that they have it. Their medical doctor is unaware that they have it, and treatment is rendered to mask symptoms related to this condition that is all too common. I want to give you the understanding that you need so that you can get well from it and address it appropriately rather than chasing symptoms for the rest of your life. And once you have this understanding, you can then be in charge of your health as opposed to chasing it. So we would want you to have complete control of your health. It is your health. This class is called When Your Health Matters. So hopefully you'll remember this information after you've heard it once, because it is pretty, what's the word I'm looking for? It's pretty interesting to understand this. If you have the understanding, then you go from being a passenger in your own health to being the creator of your own health. And so what is the problem that I'm talking about here? It's the condition of parasites. Parasites, you say? Why would we need to talk about parasites? Well, parasites and what health conditions that they seem to help manifest within people is something that I've seen consistently for over 31 years. I've helped people with these conditions for over 31 years. What are the conditions caused by parasites? All disc herniations, every last one. Even if you've had disc surgery, you have a parasite. And it's really that simple. What other conditions? All irritable bowel syndromes, colitis, Crohn's disease, diverticulitis, inflammatory bowel disease, inflammatory bowel syndrome. These are all related to having a parasite. And last but not least, believe it or not, all cases of cancer that I've seen over the last 31 years have all demonstrated a parasite in the gland or the organ or the tissue associated with where they have the cancer. Well, what types of cancers have I seen over the last 31 years? I've seen brain, I've seen salivary, I've seen throat, I've seen thyroid, I've seen thymus, I've seen lung, I've seen liver cancer, pancreatic cancer, kidney cancer, intestinal cancer, ovarian cancer, uterine cancer, prostate cancer, testicular cancer, kidney cancer. Every last one of these cancers and any other type of cancer that you could have all been related to and had an underlying component of having a parasite. Now I need you to appreciate, just because you have a parasite doesn't mean that you have cancer. I want to be really clear about that. But what I have seen in every single one of the patients that I've helped with cancer is that if you have cancer, a component associated with it is a parasite, and it would behoove you to address that appropriately. And what I have seen is that when you treat the person for the parasite and you get rid of their parasite, all their cancer indicators seem to magically improve. Again, I'm not saying that parasites cause cancer, but they're definitely involved in the process of manifesting cancer. So when the body has a parasite, appreciate that it's going to feed off of the tissues. That's why you get a disc herniation, because the annulus fibrosus, the toughest tissue in the body, designed to get stronger the more stress you put on it, gets compromised. And the thing that compromises it would be a parasite. Parasite will eat at the annulus fibrosus, and then you can bend, sneeze, lift, turn, twist, and all of a sudden you're going to have a ruptured disc. And the orthopedics, the neurosurgeons, etc., they may go in there and they may address the direct results, the disc herniation, but they're not addressing the underlying cause. And until you address the underlying cause, chances are you're going to get another disc herniation at a future time. So we want to make sure that you address that. Parasites alter normal physiological functioning of the cells. This is why you get the digestive upset. Usually if the parasite has infiltrated the gallbladder system, it's going to create any level of digestive irritation, causing the irritable bowels, etc. How does one know if they have a parasite? Well, it's very simple. You can do a complete blood count, known as a CBC, with a differential where you get the breakdown of your red and white blood cells. And when you look at the white blood cells, your white blood cell count is going to be above 6. Okay, they'll let it go all the way to 11 before they consider it being a problem, but anything above 5.5 is considered abnormal. So 6 or above in your white blood cell count indicates that you have some level of infection. So if you go a little bit deeper and you look at the monocytes, the eosinophils, and the basophils, which are a subcategory of white blood cells, the monocytes will be above 8%, the eosinophils will be above 3%, and the basophils will be above 1%. If you have all of those markers, you have parasites. It's your immune system letting you know that you have parasites. Last but not least, on a blood chemistry, if you get your alkaline phosphatase measured, if it's above 80, you have a parasite. So with the monocytes, the eosinophils, the basophils, those being elevated above 8, 3, and 1% respectively, the alkaline phosphatase being above 80, and your white blood cells being above 6, these are all indications that you have a parasite. Now, what can we do to help that? Well, the nice thing is that the solution isn't all that difficult. You come into my office and we are going to identify if you have a parasite. It could be one of several different types of parasites. You can get a Giardia lamilia, an Entamoeba histolytica, a Cryptosporidium. You can get a fat parasite. Lots of different types of parasites that you can get. If you have a parasite and your body indicates that through the manual muscle testing that we do specifically for parasites, then we will treat you appropriately and we will give you the nutritional solution. But the nutritional solution only works once the body identifies that it does have a parasite. Now, parasites are interesting organisms in the fact that they want to go undetected. Therefore, they have a cloaking type mechanism that doesn't allow the immune system to find them or see them or develop a normal immune response. But once we give the appropriate food supplement and we've gotten the body to acknowledge the fact that it has a parasite, well, now the immune system can go do its job. If it has the supplement, it has the fuel in which to do the job. And if it has the recognition, which is what we do in the office, then the body can go about eliminating the cause and getting rid of the parasites altogether. So, the question that you need to ask yourself now is, do I have a parasite? Well, if you have a disc herniation, I can just about guarantee that you do. If you have any form of cancer, I can just about guarantee that you do. If you have any digestive upset, irritable bowel, reflux, diverticulitis, Crohn's disease, any of those types of digestive upsets, you have a parasite. And the nice part is we can help you with that. So what you would need to do is just simply pick up the phone and give me a call, 845-561-2225. You can email me at docrick@spineboy.com, or you can stop into the office, and we will look forward to helping you and getting you back into the game of life. And I want to thank you for tuning in. Look forward to your emails and your phone calls, and please allow me to help you if this is appropriate for you. Thank you very much, and have a great day.